Hey y'all, I'm Lauren. I'm a disability activist in Indiana and have been working in the Medicaid provider world for a couple decades. There's been a lot of talk recently about the Health and Hospital Corporation of Marion County, Indiana, because of an upcoming Supreme Court case, Health and Hospital Corporation, Marion County, Indiana versus Tlefsky. I'm just going to say HHC from now on because Health and Hospital Corporation is a bit of a mouthful. I wanted to make a video to tell you a little bit about who the HHC is. That doesn't sound too sexy, I know, but just stay with me for a few minutes because you're going to hear some pretty corrupt shit. Indiana has always been one of the best states at scamming federal Medicaid programs. Total pros at taking federal money from disabled, poor, and elderly folks and putting that money back into their general fund. We'd be here all day long if we talked about that, though. Read Daniel Hatcher's The Poverty Industry. He explains exactly how Indiana pulls off that con. Anyway, the HHC is an Indiana municipal corporation and government agency. It runs Marion County's hospital system and their health department. Marion County is where Indianapolis is located, by the way. The important thing to remember is that the HHC is a government-ran, not privately ran entity. So technically, it should behave in the best interest of Indiana's citizens and not its own. I say technically because, well, we're going to get into all that. Way back in the 2000s, HHC was not doing well financially, like operating at an annual $30 million deficit not well. State legislators weren't happy about that. They love their money more than pork tenderloins. Hey Hoosiers. Legislators pushed the HHC to get with the State Human Service Agency to figure out how to get more federal aid dollars. They came up with the perfect plan. Exploit the elderly living in for-profit nursing homes. Basically, HHC figured out a way to turn old folks in their last years into profits. They created a scheme to get more federal aid for their nursing homes, but then pocket it instead of putting it into improving the lives of folks living in those homes. You know, what the money's supposed to do. HHC began getting with Indiana legislators to begin working their con. Here's how it works. State legislators oversee what types of places get the most federal Medicaid maximum payments for services, like providing nursing home care. In 2001, Indiana lawmakers passed legislation that said the maximum Medicaid payments would go to who? You guessed it, state government-owned nursing facilities. With this legislation in place, HHC went from potato chip greasy to 8-piece bucket KFC greasy. HHC started purchasing low-performing nursing homes, the worst of the worst. It bought its first 12 in 2003. Bought is in air quotes because the HHC didn't actually purchase the nursing homes, nor did it take over managing the homes. Instead, HHC bought the nursing home licenses and leased them right back to the nursing homes that owned the rights. If HHC wasn't operating the nursing homes, then who was? Great question. HHC hired the private company American Senior Communities to do that. Who was running things before? You know, when the nursing facilities were total shitholes? American Senior Communities. The whole we're buying up these bad places to make them better is absolute bullshit. The same corrupt company that was providing horrendous care was still providing the horrendous care. Only this go-round, the HHC was taking money that was supposed to go to making the residents' care better and putting it right back into their own pockets. HHC couldn't care less about improving the lives of nursing home residents. They just care about funding their own projects. So how much money are we talking here? After the HHC purchased the nursing homes, they received at minimum an extra $55 per day per resident because they were government-owned. HHC then routed most of that extra money to themselves. $55 a day doesn't sound like that much, but for a nursing facility that has 50 beds, that's $2,750 a day, or a little over $1 million a year. In 2012 alone, before HHC began purchasing even more nursing facilities, we're going to talk about that in a minute, HHC made $104 million. So what does HHC do with this money it has stolen from one of Indiana's most vulnerable populations? They fund vanity projects, like building a new $750 million hospital in Indianapolis. I'm not a monster, and obviously not against new hospitals being built, but there was no need to take money that was supposed to go towards caring for the poor and elderly disabled and creating a palace celebrating vanity and ego, including an entire center in it named after an HHC board member. Hey Greg, shame on you for not pushing to drop Tlefsky, by the way, because you know intimately the impact that it will have on disabled folks. Lauren, palace seems a little bit dramatic. Okay, hear me out. This hospital, Eskenazi, has so many pieces of expensive artwork that it has something called the Eskenazi Health Art Collection. This includes mammoth pieces, such as a huge wooden sculpture hanging in one of the main walkways and decorative fins atop the building designed to shimmer in colorful light. The hospital also has a 5,000 square foot sky farm on the roof where patients and employees are supposed to come pick their own fruits, flowers, and vegetables. Why go to the farmer's market when you can just go to the hospital? Honey, when you go get your chemo treatment that insurance probably won't even cover, can you pick me up some rhubarb? I think the long-term director for United Senior Action summed it up best when the hospital was being built. Quote, "They are funding this hospital literally on the backs of these nursing home residents." Listen, I ain't against publicly funding art and community gardens. We absolutely should do that. However, we shouldn't fund these things by stealing money from the poor, elderly, and disabled. HHC's scheme worked so well with the first 12 nursing homes that it went ahead and purchased 66 more since then all over the state of Indiana. In fact, they now own 78, 15% of all of Indiana's for-profit nursing homes. This grift by HHC was so successful that other county-owned hospitals decided to do the same damn thing. Stealing money from disabled folks is so popular in Indiana that over 90% of nursing homes are now owned by county hospital corporations. When something's rotten, all the vultures show up, right? But we're not talking about the other hospitals right now. Back to the HHC. So how bad are the HHC nursing homes? Bad. Real bad. Don't take my word for it. Let's turn to an expert. Daniel Hatcher, who wrote the book, The Poverty Industry. He gives the following stats in his book, taken from a 2010 article from the Indianapolis Star. 10 out of the 17 nursing homes HHC purchased in 2003 had worse state report card scores 7 years later. In nationwide federal 5-star rankings, 16 out of 27 nursing homes purchased from 2003 to 2008 received the lowest ratings possible. And the amount of time nurses spent with patients declined at 25 out of those 27 nursing homes. 8 nursing homes owned by HHC, including 4 homes that HHC owned since 2003, appeared on the federal government's 2009 list of most poorly performing homes. I also want to add that Indiana ranks 44 out of all the states in nursing home quality ratings, earning it an F grade. Also, 28% of nursing homes have serious deficiencies, which means that residents are actively being physically harmed and in jeopardy. Want to know why no one's doing anything about this? Because this isn't a broken system that needs fixed. This is a carefully designed mechanism built by greed and ran by a group of board members that couldn't give two shits about harming anybody. HHC and other county hospitals have the perfect con. Get as many elderly and disabled people into their nursing facilities as they can, even though community care options exist where people can stay, in their own homes. Dope them up with unnecessary psych meds so they can be tucked away quietly in a corner and turn them into ATMs. Think I'm kidding about the psych meds? I'm not. A 2013 study shows that nursing homes have been giving over 1 out of 5 residents anti-psych meds. These are folks who more often than not have never had a psychiatric diagnosis in their lives. The Chicago Tribune investigation found that, quote, "Some residents on anti-psych drugs become so lethargic they must be hospitalized. They cannot feed themselves, attend physical therapy, or talk with loved ones. Residents once capable of caring for themselves become immobile and incontinent." You see, it's better for the HHC nursing facilities because if everybody's doped up and sleeping, then they don't have to have as many staff members and can make even more money. So there you go. You have the information now, and I'm going to put all the sources down in the description. What you do with the info is on you. So why do places like the HHC get away with cons like this? In the words of Dick Gregory, but in a different context, it's happening because we tolerate it.